All right. So before we begin this webinar, we would just like to remind the audience that this session is recorded and that the data you provided will only be used for registration purposes and future event invitations. If you have any concerns, please feel free to message me or Hans directly in the chat box. I solemnly pledge to dedicate my life to the service of humanity
and to the protection of natural systems on which human health depends.
The health of people, their communities, and the planet will be my first consideration.
And I will maintain the utmost respect for human life, as well as reverence for the diversity of life on Earth.
I will practice my profession with conscience and dignity.
In accordance with good practice, taking into account planetary health values and principles.
To do no harm, I will respect the autonomy and dignity of all persons in adapting an approach.
To maintaining and creating health, which focuses on prevention of harm to people and planet.
I will respect and honor the trust that is placed in me and leverage this trust
to promote knowledge, values, and behaviors that support the health of humans and the planet.
I will actively strive to understand the impact that direct, unconscious, and structural bias may have
on my patients, communities, and the planet, and for cultural self-awareness in my duty to serve.
I will advocate for equity and justice by actively addressing environmental, social, and structural determinants of health,
while protecting the natural systems that underpin a viable planet for future generations.
I will acknowledge and respect various sources of knowledge and knowing regarding individual, community, and planetary health,
such as from indigenous traditional knowledge systems, while challenging attempts at spreading disinformation that can undermine planetary health.
That I will share and expand my knowledge for the benefit of society and the planet.
I will also promote transdisciplinary inclusive action to achieve individual, community, and planetary health.
I will attend to my own health, well-being, and abilities in order to provide care and serve the community to the highest standards.
I will strive to be a role model for my patients and society by embodying planetary health principles in my life.
Acknowledging that this requires maintaining the vitality of our country.
I will not use my knowledge to violate human rights or civil liberties, even
recognizing that the human right to health necessitates maintaining planetary health.
I make these promises solemnly, freely, and upon my honor. By taking this pledge, I am committing to a vision of personal, community, and planetary health
that will enable the diversity of life on our planet to thrive now and in the future.
All right, so good afternoon or good morning, whichever part of the world you are. Thank you very much for joining us in our first webisode of the Planetary Health Philippines webinar series, The Climate Crisis and Mental Health, How Can We Take Action? I am Hans. And my name is Marian, and we will be your co-host this afternoon. To give the welcome remarks,
Let us hear from the director of the Planetary and Global Health Program of St. Luke's Medical Center College of Medicine and convener of Planetary Health Philippines, Dr. Renzo Ginto.
Magandang araw sa inyong lahat. Good day, everyone. On behalf of Planetary Health Philippines and the Planetary and Global Health Program of the St. Luke's Medical Center College of Medicine, I wish to thank you for joining us in our new webinar series showcasing issues, ideas, and innovations in planetary health in the Philippines. Today, we are facing many different challenges such as climate change, pandemics, food insecurity, plastic pollution, among others, all occurring at the nexus of the health of people and the planet. Ang planetary health ay ang agham ng lahat, and lahat stands for L, lupa, A, araw, H, hangin, hayop at halaman, A, ako, T, tubig, tao at tanim. Ang lahat ay magkaugnay. That's why we need to come together and work across disciplines, sectors, geographies, cultures, and generations. In this year-long series, you will see the faces and hear the voices of outstanding Filipinos who are pushing the frontiers of knowledge to solve our today's pressing problems and safeguard our collective health. I hope that this webinar series will educate us all, inspire us to act, and envision a better future for ourselves and for future generations. Again, thank you, and help us spread the positive virus of planetary health.
Thank you, Doc Renzo, for those inspiring words. Indeed, with complex challenges that we are facing today, we need to strategically and efficiently work, and that includes approaching these challenges through an interdisciplinary and intersectoral lens, which is why Planetary Health Philippines, or PH Squared, was formed. We are a community of Filipino planetary health advocates, scholars, and practitioners that came together, determined to exchange ideas, forge collaborations, and advance the new discipline of planetary health in the Philippines. Since its establishment, we have collaborated and worked in planetary health education, research, and advocacy. And this year, we are launching this new webinar series in hopes to provide more platforms for conversations around planetary health challenges and action. And ultimately, as in the words of Dr. Renzo, continue to spread the positive virus of planetary health in our country. That being said, let me pass the mic on to Hans to introduce us today's speaker.
All right, thank you, Marian. So our speaker is a faculty member of the De La Salle University, Manila, where he obtained his PhD in counseling psychology. Prior to returning to the LSU, he served as a senior lecturer at the Department of Psychology, Sunway University, Malaysia. He is an active counseling practitioner. He also works on his research programs, which include the impact of climate change on mental health in the Global South, how to use psychology in promoting environmental sustainability, and mental health of neglected and vulnerable populations. He also serves as one of the founding associate editors of the journal Global Environmental Psychology and member of the editorial board of BMC Psychology. So please give him a warm welcome to Dr. John Jamir Benzon R. Aruta.
Thank you very much, Hans, for the very humbling introduction. I'd like to thank first Planetary Health Philippines and St. Luke's for inviting me and giving me the opportunity to present my research program on climate change and mental health. And I'm very excited to engage, people outside my discipline, on the intersection between climate change and mental health. And in my presentation, I will focus on the interface of climate change and mental health, as I have mentioned, but particularly focusing on the Philippines, But because my research focuses as well on the global south, I will touch a little bit on how climate change and mental health in general is affecting people broadly in the global south, and more particularly in the Philippines. So if if we could go to the next slide, please. The climate crisis affects many people across the world in many different forms. For example, you can see on your screen melting of ice, bushfire, flooding, extreme typhoons, etc., which in turn have enormous impact on people's lives in terms of health, mental health, economy, and even, in many situations, they give actual threats to the very lives of many people. Next slide, please. And Mother Earth already gave us a deadline that if we do not reduce global warming by 1.5 degrees by 2030, and that means reducing fossil fuel extraction by 50% globally, climate change would be irreversible. Next, please. And in the discussion of climate change and human health, we already know that climate change have direct and indirect effects on physical health. For example, you see on your screen that it's associated with allergies, asthma, food, water, and insect-borne illnesses, among others. But I would like to focus more on the idea, next slide, please, that the discussion on climate change and health largely neglected the mental health aspect. That in this discourse, there's very little discussion, and fortunately, this conversation on climate change and mental health is increasing over the years. Next slide, please. And I would like to establish first, before I proceed with my next slides, how climate change and mental health are related. You can see on your screen that the relationship between climate change and mental health can be either direct or indirect. For example, in direct direct connection between climate change and mental health, in the Philippines, we're very familiar of typhoons, and we know many Filipinos are affected by typhoons, and some Filipinos experience trauma due to this direct experience. Bushfire in some countries may result to trauma. Droughts can result to depression, anxiety, among others. But climate change impacts are not always direct or observable. Some impacts can be indirect. You can see on your screen, for example, sea level rise could mean that the soil cannot be used for agriculture of purposes anymore, and therefore it could lead to indirect burden, economic burden, and emotional distress. Drought can lead to agricultural impact, which in turn can result to poverty, increased crime rate, and trauma victimization. So you can see on your screen that the impact of climate change on mental health sometimes can be direct, but sometimes can be very indirect and not directly observable. Next slide, please. And as I mentioned in my introduction, I will try to mention how global south countries are affected by climate change, particularly on their mental health. But just to define, global south countries consist mainly by developing and least industrialized countries, mainly the southern part of the world. You can see on your screen, they are the countries highlighted with red. Next slide, please. And when we talk about climate change, part of the discussion should be about climate justice. And when we talk about climate justice, this is quite complicated, but in simple terms, we talk about who or which country mainly causes climate change, who are the main contributors of greenhouse gas emissions, in other words. And at the same time, we need to talk about who are most hurt due to climate change. Next slide, please. For example, you will see here the top CO2 emitting countries from year 1750 to 2020. And you can see that the top CO2 emitting countries are mostly coming from global north or Western and developed countries, with the exemption of the rising global economies like India and China. Next slide, please. Despite global south countries contributing very minimally to climate change, they're the first one to face the brunt of the warming planet. And one example, many of you might be familiar, is the recent flooding in Pakistan, where it killed at least 1,700 people, around 500 of which are children. Thousands of families were displaced. Based on the World Bank estimation, 30 billion USD was the economic losses, and reconstruction would require 16 billion USD at least. Now, in the Philippines, we're very familiar on how we are yearly affected by typhoons and how many losses we gain. Next slide, please. And part of the discussion as well, when we talk about climate justice, is colonization. We need to recognize the long history of colonization in many global south countries and how colonizers extracted the natural resources of the colonized countries and leaving them with less resources to help them protect themselves from the impact of many environmental degradation. Next slide, please. And at this point, let me zoom in to the Philippines, a country rich in natural resources, colonized by Spain for 333 years. And I'm quite aware we have some participants in this webinar coming outside the Philippines. Philippines, as I mentioned, was colonized by Spain for 333 years, by the US for nearly 50 years, Japan for 3 years. Next slide, please. You can see on your screen how the Philippine forest dwindled before, during, and after centuries of colonization. For instance, you'll see that the 333 years of Spanish occupation made the Philippine forest reduce from 270,000 square kilometers to 210,000 square kilometers. And within 50 years, you can see that the United States colonization managed to exceed, the deforestation that took Spain more than 300 years. And the decline continued during the post-colonization. The Philippines was left with limited resources for protection and recovery. So that's just one example of the many instances where colonization is related to climate justice. Next slide, please. And we also need to mention that the Philippines is also a climate hazard hotspot because of its geographical location. Zooming into the Southeast Asia region, you will see that the redder the country, the higher the climate change hazard level. Unfortunately, the Philippines, in the words of my friend and colleague Renzo Ginto, the Philippines is the reddest of them all. And Filipinos, like many of us here in this webinar, continue to face the severe impacts of climate change. For example, we face at least 20 typhoons per year. Some of these typhoons, we are very familiar with this, become super typhoons and bring about large economic losses, and damages on livelihood, displacement for many Filipino families, deaths, and most of the time, mental health impacts. Next slide, please. And just before I continue presenting the evidence on the climate change and the mental health impacts of climate change, let me just define to you what we call as climate anxiety. Okay, so basically, climate anxiety is an emotional response. This is the psychological distress that you feel because of your worries about climate change. But one thing I want to highlight as a counseling psychologist is that climate anxiety is not a mental disorder. Okay, it is not listed in the diagnostic statistical manual that we psychologists use in diagnosing mental health disorder, because climate anxiety is a normal response to climate change, because climate change is really happening right now and already uh, bringing about negative impacts to people's lives. Next slide, please. And climate anxiety is not only your worry about the climate, but climate anxiety in the literature sometimes is defined as well as, combination of many different emotions. For example, many young people all around the world experience climate anxiety while at the same time feeling powerless about the status of climate change, feeling angry, hopeless, sad. Some people are grieving and feeling helpless and frustrated due to climate change. So when you feel climate anxiety, it's not only worrying. In Filipino, we call it aligaga. But in the context of climate anxiety, it can be a combination of many different emotions. Next slide, please. And because we have established that the Philippines is one of the most climate hazard countries in the world, evidence on climate change and mental health impacts show that the Philippines has the most number of young people who are extremely worried due to climate change. And this is the study of Hickman published in the Lancet Planetary Health, where this is the first global survey on climate anxiety involving several Western countries and a few global South countries. And we can see that the Philippines, in other words, is the most climate anxious, especially the young people in the Philippines. Next slide, please. And if we go in further detail about specific emotions, you can see that the Philippines would rank most of the time number one in terms of, for example, sadness, feeling helpless, anxious, afraid. A large number of Filipinos feeling pessimistic. What we need to mention as well, many Filipinos feel optimistic about resolving climate change. Next slide, please. Philippines also would rank first or second. Next slide, please. In terms of feeling angry, feeling guilty, ashamed, hurt, depressed, despair, and experience of grief due to climate change. Next slide. And a good number of Filipinos would feel very powerless. There's nothing they can do about climate change, and many would feel indifferent. But we need to note that a huge percentage of Filipinos as well reported no when asked whether they feel indifferent about climate change. Next slide, please. And one thing I want to relate to my discussion on climate change and global south is this very recent evidence. I think 1 week ago this paper was published where they measured how many young people felt impaired, ignored, and not talking about climate change. And you can see that global south countries like India, Nigeria, and the Philippines, and we can include as well Brazil, are the ones who have the most number of young people feeling impaired and ignored because of climate change. Though we need to note that there are also Western countries with with a good number of young people who are feeling the same thing. But one thing I want to highlight in this slide is that the emotional response of young people in the global south seems to be higher or greater, compared to their global north counterparts. Next slide, please. And one thing we explained in this paper I published with a colleague on the Lancet Planetary Health, in explaining why climate anxiety is quite high among young Filipinos, is first, we are one of the most climate hazard in the world, as I have mentioned. Second is because and I don't have evidence for this, but I am only speculating because the young people who participated in the survey are, you know, the same generation who went through climate change education. And we don't know whether climate change education is taught in a way that actually encourage or motivate young Filipinos to engage in climate action, or is it taught in a way that's fear induced or fear inducing, or in a way paralyzing, emotionally paralyzing for many Filipinos? And another thing that we explained maybe is, social media may play a big role on why young Filipinos actually react extremely to climate change. Next slide, please. And one paper that I co-wrote with Dr. Renzo Ginto is we explained and hypothesized that experience of climate anxiety in the Philippines may not be very straightforward as we think, because the Philippines has at least 7,000 islands, and I cannot imagine Filipinos living in low-lying islands experiencing the same climate anxiety as those Filipinos living in the city who experience flooding. I cannot imagine the same emotional response those Filipinos living in farming communities, because they experience different forms of or symptoms of climate change. And if you wanna, I will not over elaborate, but if you wanna read more about this, this is free access. You can access this freely in the Journal of Climate Change and Health. Next slide, please. And as I mentioned earlier, climate anxiety is not a mental disorder. It is not necessarily bad, but one thing I want to emphasize is that you need to watch out for social and occupational impairment, because many, not so many, but a few people, because of extreme anxiety due to the warming planet, would not anymore leave their homes and would not anymore socialize and would not anymore report to their jobs or at school because of extreme anxiety. But these are rare cases, but we need to watch out. Okay, and just to highlight that climate anxiety is not necessarily bad. Climate anxiety is actually something that is adaptive, because without climate anxiety we cannot act and we cannot engage in climate action. Next, and to further explain this, let's go to the next slide. For example, people who experience solastalgia. Sino sa inyo yung people who grew up in the provinces? Okay, if you grew up in the province and maybe your teenage years or your adult years, you spend some time in the city and then you go back to the province again, then you notice it's not the same anymore. It's not as green as before. That feeling of distress is what we call solastalgia. And for some people, this feeling would encourage them to engage in more pro-environmental behavior. Next, please. And some people would also experience ecological grief. For example, this is the picture of the last white-horned rhino. And the grief experienced by this person that you can see on your screen may be ecological grief, because this is the grief, the distress that they experience related to loss of species, ecosystems, or meaningful landscapes. So if you experience ecological grief, it is a normal response to what we experience. The massive mining, deforestation in the Philippines, for example, can really trigger a lot of ecological grief. But at the same time, it can also fuel environmental action for many Filipinos, particularly young people who engage on environmental activism. Next slide, please. And this paper that I wrote on ecological grief in Filipino youth, I will not over-explain, but this is basically I discuss explanations for why Filipinos experience ecological grief, especially the youth, and how can we address them. And I will briefly mention in the later part of my presentation how we can address mental health impacts of all these ecological emotions. Next slide, please. And some of you may not be very used to reading academic papers and may be overwhelmed by, the technical writing. Renzo and I wrote a think piece in the Think Global Health, written in a very simple way, very easy to understand. And if you want to see the link of between mental health and climate change, feel free to access this article. This very easily written, and it would free you from all the technicalities of journal articles. Next slide, please. But one thing I want to emphasize is who experiences climate anxiety and other climate emotions, who are more prone. Okay, based on the literature, we know that people with high concern for the environment, like people like you guys who are attending, attending this workshop, concerned enough to know about climate change, you may be more prone to experiencing climate anxiety. People who experience the direct or indirect impact of climate change, like many Filipinos, are prone to climate anxiety and other emotions, as you can see on the data that I presented. There's also some personality factors. People who are high in neuroticism. Neuroticism is a personality trait. So yung mga tao, I will code switch at this point, but yung mga tao na aligaga, maalalahanin, high in anxiety, may be prone to climate anxiety. And data as well are showing that younger adults and older children may be more prone to climate anxiety, and more especially indigenous peoples, maybe are really more prone to climate anxiety and other climate emotions, because the environment is at the core of their very lives. Next slide, please. At this point, I will discuss ways to deal with climate anxiety and many other emotions. And one thing I want to emphasize is that, knowing that you are not alone. If you experience climate anxiety, if you worry about climate change and all the environmental degradation that you witness, know that you are not alone. There's many of us who experience all these emotions, and the mere idea that you are not alone in this experience already can be therapeutic. Because knowing that there are people who experience the same thing would encourage that you come together to do something about it. Next slide, please. And like many anxiety, as mentioned earlier in the introduction, I'm a counseling psychologist and I am actively practicing. I work with children, adolescents, and young adults, and some of my patients will have anxiety, and similar to anxiety disorders, one of the most effective solution is to act on it. If you have climate anxiety, you need to act, engage in climate mitigation, engage in pro-environmental behavior, and based on evidence, it is very helpful in reducing climate anxiety. Next slide, please. And just to show you evidence that my previous statement is actually true, based on our previous research conducted among Filipinos, we found that Filipinos who experience typhoons experience climate anxiety, cognitively and emotionally. But those who experience climate anxiety are more likely to engage in climate mitigation. And when I say climate mitigation, this could mean saving energy. This could mean not eating, reducing meat consumption, or eating more vegetables rather than meat. This could mean using more transportation than using your private car, etc., etc. Next slide, please. And I just want to check my time. I just need to be aware. And some of the ways to address the mental health impacts of climate anxiety is your exposure to nature. So if I ask you, when was the last time that you nature traveled to relieve stress? Went to a nature park to relax or engage in nature-based activities? Next slide, please. If you are more frequently engaging in these activities, then you may be benefiting or reaping the mental health benefits of nature exposure. Next slide, please. For example, in Japan, there's what they call Shinrin-yoku, or forest bathing, where they just go to the forest, they take off their shoes just to, feel the sensation of their feet against the ground. Some of them would really be very, very mindful about the full experience, listening to the sound of the trees, of the wind against the leaves of the trees, and the full experience. And people who exposed to Shinrin-yoku report better mental health, in forms of reduced stress, reduced depression, anxiety, and higher levels of well-being. Next slide, please. And true enough, one of the experimental studies on nature walks and as a form of intervention for depression, this paper exposed patients with depression to nature walks over several weeks. And what they found is that those who are exposed to nature walks over the span of several weeks reported lower levels of depressive symptoms. And the effect is, as effective as medication. I'd like to take note of that. But the advantage of this compared to medication is that the effect is long term. Even if they stop already nature walks, the effect is long term. Next slide, please. And sino dito yung mga plantito and plantita? So if you're a plantito and plantita, home gardening apparently is associated with better mental health and better sleep and better physical health. This particular study was about home gardening during COVID-19 among all older adults in Scotland, and they found better physical health, better emotional and mental health among older people. And there are also evidence that this is true even among middle early adults. Next slide, please. And this is quite technical because this is multi-level analysis of data on people who do coastal visits and their well-being. So to make this explanation simple, they measured the frequency of coastal visits and the well-being of people in different countries. And what they found is that countries who have citizens who are more frequently visiting coastal areas also reported higher levels of well-being. So for example, people in Portugal reported that they visit coastal areas more frequently, and they also reported higher levels of well-being. So kung gusto mo ng country where coastal visit is more like a norm, and people have reap the well-being benefits, you go to countries like Portugal, Bulgaria, Spain, Czech Republic, Greece, Italy, etc. Unfortunately, Hong Kong is the country with least number of coastal visits and lower levels of well-being. Okay, so next slide, please. This is an evidence using Filipino samples where I found that Filipinos who feel more connected to nature have reported higher levels of mental well-being. And if you want to know more about this, you can send me an email. I'll be happy to discuss this with you. Next slide, please. And just to give you some very practical strategies on addressing climate anxiety in general, and climate anxiety emotions in general, and climate anxiety in particular, let me show you some short-term and long-term strategies. First is practice focus and deep breathing. This is one thing that I recommend as well to my patients, that they focus on mindful breathing. So people who engage in yoga, for example, are very trained in focus and deep breathing, and so they actually benefit from this, and are able to manage their anxiety quite effectively. Next slide, please. Another strategy I can tell you, and one thing I want to emphasize is that this is not one size fits all kind of strategy. Some strategies work for some people, but not for others. So you need to find which one works best for you. So for some people, going for a walk, or like 50 minutes of yoga, as I mentioned, can already is therapeutic. Going for a walk, 30 minutes per day, in the afternoon or in the evening can be helpful for some people. Next slide, please. For some of my patients, I would recommend that they write down their thoughts, because writing down what's making you anxious gets it out of your head and make the anxiety experience less daunting. That works for some people. Next slide, please. But in terms of long-term strategies, one very important skill that we all need to develop is to manage our triggers. So you need to ask yourself, when do I get anxious? And when I get anxious, what are those things that trigger me? Sometimes I would ask my patients to rank their biggest triggers. And once you are aware of your triggers, that's one important first step in managing your anxiety. That's also true in managing climate anxiety. For some people, climate anxiety gets triggered when they watch the news, or when they scroll social media, for example. So you need to know your triggers. Next slide, please. There's what we call hope-based interventions, and this is maybe more useful for mental health practitioners. That one important and effective interventions in reducing climate anxiety are interventions that emphasize hope. That there is hope in addressing climate change, and we allow people to reflect on what they can do, to make that hope materialize. Next slide, please. And some more practical steps, ways forward is, to address the climate change and mental health interface is, interdisciplinary collaboration. And I'm very happy to see that, there's an active community already growing in the Philippines on climate change and mental health. People from different disciplines are gathering together to figure out how we can contribute in addressing climate change in terms of the research, youth participation, advocacy, and policy making. Next slide, please. And I add my presentation here. If you wanna ask for the articles that I shared with you, you can email me. There's my email, you can see on my screen. And again, thank you very much for the opportunity. I really appreciate. Thank you.
All right. Thank you, Doc John, for that very insightful presentation. So before we proceed with the question and answer portion, may we request everyone to turn on their cameras for the picture taking for documentation purposes. Okay, Doc Ale, if you can.
Everyone smile in 1, 2, 3. Hey, let's wait for the others to turn on their camera.
All right. All right. Okay, so maybe we could also do one more, like a collage. Right. On your mark, Doc Ale.
Okay, 1, 2, 3.
All good? Okay.
Thank you, Doc Ale. All right. So as promised, we would like this segment to become a conversation between you, our audience, and the speaker. So we officially open the floor for questions, comments, and reflections. Please feel free to use the chat box, or you can also raise your virtual hand if you want to share your reflections and comments.
Or feel free to unmute. So who wants to start the conversation?
So maybe to start, I actually have a question for Doc John. So most of the data that you presented us were mostly focused on the youth, right? So I'm curious if there is available data that was, or studies that were conducted among the adult populations, especially on climate anxiety, since as you said, climate anxiety, conversations around it just started to pick up. So I'm curious if they also captured the adult populations, and or is it because it's more well, I guess I'll just stick to that question first. So if you can share with us if there is data.
Thank you, Marian. I think that's a very intelligent question, and I will answer your question at the global level evidence and at the Philippine level evidence. But the global level evidence, the evidence is mixed in terms of who's more anxious. Is it young people or old people? Some evidence would say that young people are more anxious due to climate change. On the other hand, there are some evidence that older people are actually more anxious. So right now, the evidence is growing, and we need to see at some point, what factors contribute to these differences. But one thing I can see in the evidence as well is that among adults who are concerned about climate change, most of them are parents, and maybe they may be concerned of climate change not for themselves but for the future of their children and grandchildren. But again, more research are needed. And then zooming into the Philippines, we know that young people in the Philippines, based on the data I presented, are extremely anxious about climate change. But we don't have data on adults and their climate anxiety, Filipino adults and their climate anxiety. But what we have is this nationally represented data conducted by um, scholars from Harvard, where they surveyed climate change awareness and engagement in adaptation across all the regions in the Philippines, nationally represented data. And overall, one of their key findings was that Filipino adults have low levels of climate change awareness in general. But adults residing in typhoon-prone areas like Bicol region, for instance, some provinces in central Visayas, for example, have slightly higher climate change awareness. And this may be because of their direct experience or the programs, climate change related programs implemented in these regions. But what I can say is that the overall low climate change awareness among Filipinos may be an indication, among Filipino adults, may be an indication as well of lower emotional response to climate change, because you cannot be climate anxious if you're not in the first place aware of climate change, right? And high awareness of climate change, we should be able to observe whether or not we are really aware of climate change as a population if we hear people talking about climate change in usual conversations. Do you see Filipino families talking about climate change at home? Do you see ordinary Filipinos talking about climate change in the streets or when you take the jeepney? Do you see or hear Filipinos, talking about this? When you talk to an ordinary person in the streets and ask about climate change, will they be able to tell you, even the most basic information? right? So that's why, nationally represented on national level survey on climate change awareness and a widespread climate education is really necessary for the Philippines. Thank you. I
Alright.
hope I answered your question, Marian.
Yes, thank you. Those were interesting points that really made me think. If I can hear anyone like in the jeepneys having these conversations, it really made me think if there were those situations. But yeah, it's not usually the topic of conversation.
Yeah,
Thank
in
you,
my
Doc
entire
John.
life, na sumasakay ako sa jeepney, isang beses ko palang narinig yung isang ale na nagrereklamo doon sa Taft na mainit daw. Sabi nung kasama niyang ale, baka yan daw yung climate change. Once ko lang
Oh
narinig yan in
wow.
my entire life.
Oh wow.
Yeah.
That's interesting. Thank you, Doc John.
Right, thank you, Doc Chan. There's a question from the chat box from Jean Mark. Do you have any data about anxiety among rural young people versus urban young people? Thank you very much for your fantastic presentation.
Thank you. Thank you for the question. You know what? I have data in the Philippines, adolescent data on climate anxiety, and I have also identified who are residing in rural versus urban, but I have not analyzed yet. So I cannot answer your question very confidently. But if I am to guess, I would say that's a tough question. I cannot make a okay, I will not answer the question because it's quite tricky because the experience of young people in the urban areas of climate change may be in different forms like flooding, extreme heat. Pero young people in the rural areas may experience climate change in different forms like sea level rise, droughts in their farms. So the anxiety may be experienced, but the symptoms are, or the observation or direct experience or indirect experience may be different. So I cannot make a final answer to that. I'd like to apologize. What I promise is I will definitely open that data set again and do an initial analysis. I have the data set. Thank you.
All right. So there's another question from Sylvia. Sir, how can we help our young adults to manage their anxiety or stress on climate change? Thank you.
Great. And I love that you asked that question. Let me know who asked the question. Sylvia, I'm happy that you asked that question because I think I can provide a very, very practical answer. One is we need to create venues where people can express and discuss their experience of climate change as well as their emotional responses, right? For example, webinars like this, already is important where people can express, but webinars may not be the perfect format for discussing climate change and emotional responses. Maybe dialogues, maybe a better format, because in dialogues everyone can be heard, everyone can express their individual and collective experience of climate change. So to answer one particular, in other words, one short answer to that question is we need to provide avenues for people to express their experience, because if we provide these avenues and platforms, people may feel a sense of uh, common humanity or common experience, that they are not anymore isolated in their worries about climate change, and creating a community, as mentioned by Marian, creating a community where people can think about solutions on how to address climate change, mental health, and their interface. Thank you.
All right.
Good question from Sylvia.
Okay, so are there any other questions? You may feel free to type it in the chat box. So I think due to the time, we can only accommodate for one more question. Okay, I guess I can ask the question then. So, Doc John, now that we have the conversation about climate change and mental health, how can you convince people to believe in mental health? Because it's still, I think, a stigma, especially in rural communities. They don't believe in mental health. It does not exist. So how do you convince those people to accept that it exists, and how can we move forward from there?
Yep. Thank you. I agree with you, Hans. And first is I need to recognize that in several parts of our country, you know, there's a high stigma on mental health, because of lack of mental health information or mental health awareness, and that is particularly true in more rural areas, you know, in the country. Um, but we also witness evidence on mental health information and, you know, awareness raising in rural areas that have been effective in minimizing stigma on mental health, right? So one way that worked in the past and continuously to work is, you know, connecting with policymakers. You know, if we connect with policymakers who are able to create policies that destigmatize mental health through awareness raising and mental health education, no, that's one very important step. And I think one important aspect as well is integrating mental health education in basic education. You know, part of me is really very hopeful that the future generations of Filipinos will be, you know, less discriminating of mental health, and we can only do that if we effectively integrate, you know, mental health information and awareness in basic education. We need to teach people to not stigmatize mental health as young as maybe primary school. You know, so we see future generations of Filipinos who recognize that mental health problems do exist, and mental health problems are real problems, you know, similar to medical problems that we experience. The only difference that mental health sometimes is invisible. Thank you.
Okay, thank you for that, Doc John. So I think Marianne.
All right, so if there aren't any more questions, you may always, if you have a question pops up in your mind and the webinar is already over, you may reach Doc John through his email. All right, so that concludes the first installment of the Planetary Health Philippines webinar series. Please stay tuned for the next webisode by following our social media accounts and website, so you can see the accounts, the handles on the screen. And if you want to join our community, send us an email at planetaryhealthph@gmail.com. Thank you very much for joining, and have a great evening.
Thank you.
Thank you.
I solemnly pledge to dedicate my life to the service of humanity
and to the protection of natural systems on which human health depends.
The health of people, their communities, and the planet will be my first consideration.
And I will maintain the utmost respect for human life, as well as reverence for the diversity of life on Earth.
I will practice my profession with conscience and dignity.
In accordance with good practice, taking into account planetary health values and principles.
To do no harm, I will respect the autonomy and dignity
of all persons in adapting an approach.
To maintaining and creating health, which focuses on prevention of harm to people and planet.
I will respect and honor the trust that is placed in me and leverage this trust
to promote knowledge, values, and behaviors that support the health of humans and the planet.
I will actively strive to understand the impact that direct, unconscious, and structural bias may have
on my patients, communities, and the planet, and for cultural self-awareness in my duty to serve.
I will advocate for equity and justice by actively addressing environmental, social, and structural determinants of health,
while protecting the natural systems that underpin a viable planet for future generations.
I will acknowledge and respect various sources of knowledge and knowing regarding individual, community, and planetary health,
such as from indigenous traditional knowledge systems, while challenging attempts at spreading disinformation that can undermine planetary health.
That I will share and expand my knowledge for the benefit of society and the planet.
I will also promote transdisciplinary inclusive action to achieve individual, community, and planetary health.
I will attend to my own health, well-being, and abilities in order to provide care and serve the community to the highest standards.
I will strive to be a role model for my patients and society by embodying planetary health principles in my life.
Acknowledging that this requires maintaining the vitality of our country.
I will not use my knowledge to violate human rights or civil liberties, even
recognizing that the human right to health necessitates maintaining planetary health.
I make these promises solemnly, freely, and upon my honor. By taking this pledge, I am committing to a vision of personal, community, and planetary health
that will enable the diversity of life on our planet to thrive now and in the future.